Started, and I wanted to welcome everybody to today's webinar, Understanding the Rapid Assessment of Pandemic Impact on Development, the Early Childhood Surveys, otherwise known as RAPID EC. And it is really my pleasure to have Dr. Phil Fisher here today, who's going to share the findings from a national survey that's really focused on the impact of the pandemic on young children and their families. My name is Evelyn Blank, and I am the Associate Executive Director of New York Center for Child Development and the Director of the Training and Technical Assistance Center. Before we get started, I just wanted to start with a few logistics about today's webinar. As we've done in the past, this webinar is being recorded and will be posted along with the slides to the TTAC website. We'll also be taking questions throughout the webinar and ask that you chat those questions into the chat box, selecting all panelists on the drop-down. And we will set time aside to really answer your questions at the end of this webinar. For those LMSWs and LMHCs interested in obtaining CEUs, you will be eligible to receive 1.5 CEUs for attending this webinar. If you're joining only by phone, we need you to log on to the WebEx via a computer in order to obtain the CEU credit. For further information, instructions will be distributed to you via email following this webinar. And finally, towards the end of the webinar, we will be texting in a feedback survey and really welcome your feedback. It really helps guide and direct future offerings that we have. So Phil, if you could go to the next slide, just a quick statement about who we are. The New York City Early Childhood Mental Health Training and Technical Assistance Center, otherwise known as TTAC, is funded through Thrive NYC in partnership with the New York City Department of Health and Mental Hygiene, DOH-MH. TTAC is a partnership between the New York Center for Child Development and the McSilver Institute on Poverty Policy and Research. New York Center for Child Development has been a major provider of early childhood mental health services in New York, with expertise in informing policy and supporting the field of early childhood mental health through both training and direct practice. NYU McSilver Institute for Poverty Policy and Research houses the Community and the Managed Care Technical Assistance Center, otherwise known as CTAC-MTAC, which offers clinic, business, and system transformation support statewide to all behavioral health providers. And TTAC is tasked with building the capacity and competencies of mental health and early childhood professionals through ongoing training and technical assistance. If you go to the next slide, you'll just have a screenshot there of our website. So those that are interested, you can find our archived webinars there and other resources. So it is now my pleasure to introduce Dr. Fisher. Dr. Fisher is the Philip H. Knight Chair and Professor of Psychology at the University of Oregon, where he serves as founding director of the Center for Translational Neuroscience. He is also a senior fellow at the Center on the Developing Child and a member of the National Scientific Council on the Developing Child, both based at Harvard University. His research, which has been continuously funded by the National Institute of Health since 1999, focuses on developing and evaluating scalable early childhood interventions in communities and on translating scientific knowledge regarding healthy development under conditions of adversity for use in social policy and programs. He is particularly interested in the effects of early stressful experiences on children's neurological and psychological development, and in prevention and treatment programs for improving children's functioning in areas such as relationships with caregivers and peers, social emotional development, and academic achievement. He is currently the lead investigator in the ongoing RAPID EC project, which will be the focus of today's presentation, which is a national survey on the well-being of households with young children during the COVID-19 pandemic. He has published over 200 scientific papers in peer-reviewed journals, and he is also the recipient of the 2012 Society for Prevention Research Translational Science Award and a 2019 Fellow of the American Psychological Society. So Dr. Fisher, thank you so much for joining us and for bringing this really important topic to us. Thank you.
Thanks, Evelyn, for that introduction. I just want to make sure that everybody can hear me okay. If not, I'm sure I'll be hearing from somebody running the webinar. So it's really a pleasure to be here and to be able to speak with you. We have been really motivated to share information from the survey that Evelyn mentioned. And so I will be presenting a lot of data, including some very new data that we've been discovering from that survey. really want to start by just acknowledging the cast of characters, and there's been quite a large one that's been involved in the work on the rapid EC surveys. And I say surveys because we started over a year ago now with a national survey of households, but we've actually recently expanded to include a second survey that's running in parallel of early childhood providers with a specific emphasis on family, friend, and neighbor care. And so we have two advisory boards that are guiding that work and providing tremendous amount of input into the content of what we're asking and into the dissemination of results. The chair of both is Joan Lombardi, who's a long-time child advocacy expert who's been in a number of presidential administrations and also in the private sector, and is just a really big champion for early childhood policy and programs. And then we also have a working group that's been really instrumental in helping to focus the information that we're gathering so that it has the greatest potential impact on overall policy and programs for early childhood. As I'm sure is true of many people listening in today, recent developments in terms of what's happening with the Biden administration and what we see in terms of budgets focusing on early childhood development, on childcare, on early childhood education, on healthcare are really historic in terms of what we think the potential is for supporting those children and those who are in the lives of young children. And it's extremely important that we take advantage of that, given what we've been learning about what families have been going through during the pandemic. The project has had a number of funders, including some recent funders, but from the get-go, Heising Simons Foundation and Pritzker Children's Initiative have been supporting this work, and were really able to help us get it off the ground really quickly when we decided that we wanted to do it last March. By the time early April had come around, we were already up and running. We also have a number of partnerships with key organizations through which we're both thinking about survey content and disseminating information. Homegrown in particular, I'd like to call out as a organization that really has focused on family, friend, and neighbor care. And the RISER Network, which is a group of Black child development researchers, has been instrumental in helping us understand how we can gather data related to structural racial inequalities and issues of equity, and how we can interpret and make use of that data. And in fact, they've been taking the lead in terms of really the issues around racism, discrimination, and structural inequalities in both the questions that are being asked and in the dissemination of information on that topic. We just actually published our year-long summary of what we've been finding. And in the chat, you should see a bunch of links. One is to a series of blog postings that show results from the survey over time. And in that link to medium.com is our most recent posting, A Year in the Life of the Pandemic, which sums up some, but not all of what I'll be talking about today. And I really encourage participants to look at those links. There's a wealth of information there, including media stories about the survey. I think for many people, one thing that may be interesting is that we actually have an open access item bank where you can look at all of the questions and, for that matter, access them and put them into surveys of your own if you're interested in doing that. So lots of resources available in the chat. So let me just dive into a little bit more detail about what the survey actually is. It's ongoing. And the household survey since last April has been focusing on households with at least one child, age 5 and under. As I mentioned, it's a national sample in terms of geography, so we have participants from all 50 states. It's very diverse in terms of race and ethnicity, as well as income. How do people complete the survey? Well, it's available online. And so if you have a smartphone, a tablet, or a computer with internet access or cell service, you don't need high-speed internet, you can access it. It's a questionnaire format. It's available in English or Spanish. When we started the survey, we knew that we needed to be gathering information on a very regular basis because things were changing so rapidly last spring. That's really continued in terms of the amount of kind of dynamic information and things that are changing in terms of things like infection rates and vaccines becoming available, openings and closings of various communities due to infection rates. So we started with weekly surveys. We did weekly surveys from April through July. And then starting at the end of July, we shifted to every other week. Every time the survey goes out, we hear from over 1,000 families. And so we've actually had more than 9,000 people take the survey so far. And in addition to the quantitative data that I'll be sharing, we also discovered that it's extremely important and really helpful to give people the opportunity to respond to more open-ended questions like, what are the biggest challenges that you're facing? What things are providing the most support to you in this time? What would you like your policymakers to know? And people have been very eager to share what they're going through. So we've had actually at this point over 140,000 responses to those questions, which have provided a real goldmine of voices from the pandemic. I'm going to be talking about information that we've been collecting on a variety of different topics in the pandemic. So first of all, we ask about both parent well-being and child well-being. And we do so for parents by asking about their stress, their depression, anxiety, and loneliness. For children and children's well-being, we ask about, since these are young children, about whether they're fussy or upset, and also whether they're fearful or anxious. We've gathered a tremendous amount of information about the economic circumstances that families are facing during the pandemic, and now more recently that childcare providers are facing, and I'll be sharing some of that. We have gotten a lot of information about childcare and a lot of information about pediatric healthcare, and these really sort of form a holistic picture of what the experiences are for young children and for the adults in their lives since last April. I'm going to start because I believe, although I might not be exactly right about this, that a lot of people listening in may be people who work in early childhood special education or in infant and child mental health. And so I'm going to present a lot of overall data, but I wanted to contextualize this presentation in terms of specifically what households in which there's a child with a special need have been dealing with during the pandemic. We have consistently seen that these households are experiencing more challenges and are really in need of more support than others. So for example, if you look at this slide, this just shows how adult distress in households with a child with special needs looked before the pandemic and how it looks now. And you can see the red bars show households with a special needs child. Before the pandemic, they were higher in terms of these distress levels. They've jumped up considerably over the course of the pandemic and have remained higher than those without disabilities. I think that's just a sign of the strain that parents have been under. And if you look at trends across time, that hasn't just been true at one time point or another. One of the benefits of being able to measure these things across time is that you can see that pretty much after the survey started, so this is in April where our first survey started, you can see that the rates of adult distress have been consistently higher for households with a special needs child. The same is true for children over the same period of time. So we're actually seeing the same kinds of trends for children. Not surprisingly, this is this main measure of child distress where we see these things have consistently remained higher for children as well. I think it's no surprise given that services for special needs children and to support households were typically delivered in person before the pandemic, and there have been many challenges associated with getting those services to families or having remote services really be effective during this time. We've also seen with special needs households that healthcare has been impacted, in particular healthcare, preventive healthcare, well, child visits among children ages 3, 4, and 5 seem to be really impacted. A lot more missed visits for this age group. This is particularly concerning in terms of these visits helping to track developmental progress for kids with special needs and make sure that there's referral to appropriate services. So we've been paying a lot of attention to that. Also, households with special needs kids have significantly lower levels of social support. That was true before the pandemic, and it remains true at present. We have developed some supports, and I just want to connect people to this particular website to provide supports remotely to households and, for that matter, to childcare providers in general. And I think it's especially potentially useful for those who are having difficulty getting the supports that they might need elsewhere. It's called FAST, and it's a telephone and text line. And so if you're interested in learning more about that, I encourage you to look at the web link here, but also you're welcome to reach out to me by email. So as I said, I wanted to sort of start with what households with special needs kids have been experiencing, because I think it may be relevant to this audience. But let me now zoom out a bit and just talk about the main findings from the survey thus far. And they really fall into a number of discrete categories. So the first one is that if you want to know how households with young children have been doing during the pandemic, the story is really one of looking at the extent to which families are having difficulty paying for basic needs. So this concept of material hardship is really, can you pay for core things like food, housing, utilities, healthcare? And when we asked the participants in our survey, are you having trouble paying for any of these things? This is the proportion of households that are saying that I'm having trouble paying for at least one basic need. And this is during the first period of the pandemic. So when we started in April, and you can see that over that time, that consistently, that the rates of material hardship went up during that time. If you look at what happened in the second period of time here, sort of in the midsummer through the fall, things kind of leveled off. So we started with about 1 in 4 of all families in our survey with a young child having difficulty making ends meet. By the time we got to the CARES Act ending in the middle of the summer, it was as many as 1 in 3 or even more that were having difficulty paying for a basic need. And then what we see is that in more recent months, things are actually starting to look improved. So we see that the numbers have gone down. That's promising. It probably has something to do with jobs returning and also with some of the pandemic relief that's become available. But I just want to note, even though the numbers look better, we're still talking about 1 in 4 families with a special needs child that can't make ends meet. What is it that people are having difficulty paying for? So these are the categories that we asked about. And what you can see is that the one area that has the sort of significantly highest proportion of households saying they can't pay for it is utilities. And we think that's interesting. Food, housing, and utilities are kind of the big 3. But you think about this as sort of a hierarchy of needs. Probably people are paying for food first and foremost. Then to the extent they're able to cover the rent, they might be paying that. Utilities are kind of coming last. And so that's where we see the highest proportion. But again, large proportion of households with young children who can't pay for these very basic needs. And you can see these kind of adding up for households. The challenges have been especially great for the lowest income families. So this red bar represents across time families who are 200% or more below the federal poverty line, based on the number of people in their household. And you can see that in those households, the rates of families who were reporting that they can't make ends meet has been as high as 60% across the survey. Even in this middle income group, you can see that for a lot of the time that we see at least 1 in 4 families who can't make ends meet. And interestingly, even in those households that are 400% or more above the federal poverty line, we're still seeing pretty consistently that 10% of families can't make ends meet. These income groupings, I should note, are based on what people's income was before the pandemic. So these probably indicate in many instances, especially in these groups, people that were doing better, but as the pandemic came about, they lost their grasp on kind of well-being financially and started having real difficulties paying for things. And again, it's just noteworthy. It's not just the lowest income families, but it's those at middle and even more high income that are struggling with these issues. We also see that debt has increased. This is a separate slide. That the amount of volatility in income has been a challenge. So how much is your income changing from time to time? This is particularly true in the lowest income groups, but also in the middle and higher income groups, that people have experienced a lot of changes in the amount of money coming in from one time point to another. This is also true, not just in terms of income, but single parents have experienced a lot of instability in their income as well. How does this relate to kind of the overall sort of financial picture for parents? Well, we see that overall for parents with young children, that debt has increased for many of them. So 50% or more, 1 in 2, say that they have more debt than they did a year ago. Interestingly, that's not just true for the lowest income group. It's true across the board that at all income levels, people are reporting that they owe more money than they did a year ago, which suggests income loss in all groups relative to how things were before the pandemic. And another indication of what households with young children have been going through financially comes from when you look at this particular slide that shows that in terms of how people used the pandemic financial relief, even in the highest income groups, we see more than a half saying that they're using the pandemic relief for basic necessities, things like food and housing and utilities, rather than for recreational sources or savings. So I think that's really noteworthy. I want to make a connection now because I've been talking a lot about the financial circumstances and debt and things like that. But the reason that should concern us, for all of us who are early childhood professionals, and for those in the lives of young children, is because of the impact that kind of stress, the financial stress and the material hardship, is having on well-being. So you might remember that I mentioned that we measure parent well-being and child well-being, and we measure it on a kind of 1 to 100 scale based on those different categories that I was talking about. Well, what you can see here is that for parents, as the number of areas in which they're experiencing hardship or not able to make ends meet increases. So if it's none, then it's about a third, or sorry, it's about at a 36. But as we go up in the number of hardships that people are experiencing, having difficulty paying for one area of basic needs, 2, 3, or 4, you can see this stepwise pattern where the amount of distress is kind of increasing in a linear manner related to the number of hardships that people have. And this exact same thing is true for kids. Fewer hardships means that kids are doing better. More hardship means that kids are doing worse. It's not just sort of an association. It actually is a sequence of events in our data when we followed families across time that unfolds in a very reliable and predictable manner. And so we have called this the chain reaction of hardship. What we find is that in a given week, if an adult reports that they're having difficulty making ends meet, that plays out subsequently, that in weeks where we follow up with those adults, they're more likely to report higher levels of emotional distress. And when we follow up later, those who report more distress on their part are more likely to report that subsequently their child is experiencing more distress. So things kind of start and are rooted in difficulties paying for basic needs, but it gets passed on to children through the amount of distress that parents are experiencing. It's not just, by the way, if you're having difficulty making ends meet, it's also the extent to which your income is changing and unstable. So when we looked at those volatility measures the extent to which your income isn't predictable from one time point to the next, that also predicts the extent to which adults and children will be experiencing distress. And that's true across all income levels. So unpredictability is another factor that we should be really concerned about. Why is this first piece of data about material hardship and basic needs and how it relates to adult well-being and child well-being, this whole chain reaction of hardship, so important? Well, we've been doing research for years, and we have many colleagues around the US and globally who do work in similar areas on this topic of toxic stress. Toxic stress isn't just when you have a bad day or you're waiting in line for coffee and it takes forever, although that can feel pretty toxic. But toxic stress is actually a pretty technical term. And what it means and what it comes from is when biological systems that are designed to help us respond to stress are chronically activated in young children because things are ongoing in a difficult manner. So all these systems that naturally turn on and help do things like stimulate the immune system and help release stored energy in the cells and things like that, those kinds of things, when they're ongoing, become problematic. They're really designed to be sort of turned on and then turned off after the threat's gone. When those kinds of chronic stressors occur in the context of unpredictability, the kind of income volatility that we've been seeing, and all of the other uncertainty of the pandemic, that makes things worse. And there's tons of research in humans as well as in animals that shows the negative impact of unpredictability. And then the third kind of piece of this is that we really have evolved as a species to have adults be the ones who provide kind of the external buffering from those kinds of stresses. It's adults early in life who help shut those biological systems down. That is, by nurturing and responding and comforting children, that's really the process that helps to turn off those biological systems in response to this ongoing stress. And yet we see in the context of the pandemic that many adults are reporting that they're having a difficult time because of these basic issues around not being able to pay for food, not being able to get to places where you can get free food, and a variety of other things. And so that's really where we're concerned, that the kind of long-term effects that have been documented in terms of things like children's brain development, social emotional development, even physical health, cognitive development, academic achievement, that in the absence of kind of the supportive care, not because people have not been interested in providing care for their children, but just because so many households are worried about just basically getting by, that we're concerned about what we'll be seeing. I do want to say there's silver lining in the sense that, number one, a lot of households are reporting emotional support makes a big difference, including emotional support that they get from their young children just by being around them. So there's sort of a relational health component to this. And also that to the extent that things get better, there is lots of evidence of plasticity in the biological system, so that even after exposure to toxic stress, that kids can do a great kind of job of rebounding and being okay. But those supports need to be in place for children, and they need to be in place for the adults in the lives of young children as quickly as possible in order to get things back on track. And I think that's where we're at right now, is how do we get things back on track for children and for providers? Okay, that's sort of piece number one. I'm going to move on now to the second part of our findings, which I think require and deserve an equal amount of attention to the chain reaction of hardship data. So the second big finding in our data is that during the pandemic, gaps that existed in equity based on race and ethnicity have grown considerably wider over time. So this is a slide that shows just that same issue of the proportion of families that are reporting at least one area of basic needs that they're struggling to cover financially. And what you can see is in the chart on the left is Black households, in the middle is Latinx households, and in the right is white households. And you can just see a tremendous disparity in the proportion of Black and Latinx households across time that have had difficulties paying for basic needs relative to white households. White households, again, still very concerning, 1 in 4. But in Black and Latinx households, it's been much higher, consistently as high as 40%, or in some cases 50 and even 60%. The other thing that's quite noteworthy is that in recent time, in the last few months, we have been seeing a general decrease in the rates of material hardship, sort of for the overall sample. That's clearly playing out for Black households when we just look at that subgroup. There is less of a decrease in material hardship in Latinx households. And one reason that we think that may be the case, although we don't have specific data on it, is that availability and access to governmental relief may be lower in Latinx households with young children because of issues around not having citizenship status and things like that, but also around people being fearful of interacting with the government in general. And so our concerns are that in Latinx households, that the inequalities having to do with material hardship are going to be even harder to mitigate. We also, in terms of structural inequalities, I just want to show this slide very quickly, but it's noteworthy that in particular, some of the biggest challenges that we see in terms of material hardship have to do with households that are at the higher income level. So if you look across the lowest income groups in pink here, you can see that the rates of material hardship have been relatively similar for Black, Latinx, and white households. But when you get into the middle and upper income groups, that's where we really see the biggest difference. So these are households that were more prosperous before the pandemic and are clearly having higher rates of material hardship. And these are the most prosperous households. And again, we see a lot of, at various times, a lot of these households that were doing better financially during the pandemic, who are now having more difficulty relative to white households. There are a variety of explanations for these challenges for middle and upper income Black and Latinx households. There's a well-documented wealth gap, less access to wealth, less accumulated wealth, more difficulty obtaining credit and loans when needed, and a variety of other things such as supporting extended family members who are less prosperous, and having, even if they're higher paying jobs that were less secure before the pandemic and therefore more job loss. We also see more income volatility, so those unpredictability of what your income is going to be and more changes across time in Black and Latinx households than in white households. We see that debt, the amount of debt relative to debt before the pandemic is highest in Black and Latinx households, and that it's increased the most, in particular among Latinx households during the pandemic. Again, this could be an indication for Latinx households that other sources, especially federal relief, was less accessible, and that required, therefore, to make ends meet for more accrual of debt, credit card debt, taking out loans, getting loans from family members and friends in particular in this subgroup. We can see a variety of different sources of debt that vary based on the groups that we're looking at. And we can see particularly a lot of student loan debt and a lot of credit card debt in Black and Latinx households. As I mentioned, we see much higher rates of debt from loans from family and friends. This is the extended family members helping out to help make ends meet in Latinx households. The other very clear example of structural inequalities that has come out of our data based on race and ethnicity can be seen in some analyses that we've done of our open-ended questions during the pandemic. So we asked people, among other things, what are some of the biggest challenges that you and your family have been facing during the pandemic? And what we are able to do then is analyze all of those open-ended responses where people just type in stuff about what's going on and develop themes based on a particular analytic technique that analyzes text. When we look at what the biggest challenges are that are being reported by white households in our survey across all income groups, what we see is largely kind of concerns and challenges that are based on social deprivation effects of the pandemic, missing other family members, isolation, concerns about how your older children are doing, sleep problems, and things like that, worried about moving. When we look at the concerns, the biggest challenges that Black households are reporting and the frequency with which they report them, first of all, just paying for basic necessities, making ends meet or getting by, is off the charts in terms of how frequently that's reported. Concerns about safety and your ability to what you're going to do for work, as in terms of returning to childcare, debt, house and car problems, paying expenses. These are not just sort of, these are the concerns above are not insignificant, but they're really about kind of how you're dealing emotionally. Whereas these are much more themes that are related to basic survival. And I think it's important to recognize that the pandemic has really not played out the same for everybody, and that there have been a variety of different pandemics, really, that depending on what your circumstances are, depending on long-standing issues based on racial and ethnic disparities and other kinds of issues, that your experiences during the pandemic may have been very different from others. Okay, so I want to move on now to another topic, which is how healthcare has been impacted. And so one thing that's really important to note is that overall, parents of young children report that in their households, that delaying healthcare, not getting to the doctor, has been an extremely common experience. Over 83% say that they haven't actually gone to the doctor when needed. And this is for all family members, that they just didn't participate in healthcare. We're especially concerned about the amount of missed routine vaccinations and missed well baby visits that we're seeing overall. So about almost one in two children, but slightly less than that, had missed at least one well baby or well child visit checkup during the pandemic. Those typically that have been missed are more among older children, which is promising. But nevertheless, given how much healthcare is a place where there is screening and identification of delays, but there's also an opportunity to identify relational issues that are concerning, maltreatment when it's concerning, all kinds of things like this. The fact that there's been less contact with the healthcare system is of concern for us. And again, I think this is probably true for a lot of people listening, that one of the things that we're concerned about as things begin to reopen is that we are able to be sensitive and pick up on those households and those children that have really had a rough time, so that we can get them as quickly as possible to the referrals and the services and supports that both the children and families need in order to move in a positive direction. And again, I'll note here that where healthcare was affected for all households with children under age 5, it was particularly impacted among households where there's a special needs child. So the last area that I want to focus in on during my presentation is really about childcare. And if there's anything that our team has learned during the pandemic, and I think this probably is something that a lot of people have experienced personally, I know we have, as well as just in terms of the data, is that childcare, when it goes away, really removes a fundamental foundational support that families need in order to be able to earn money, in order to be able to make sure that their child is okay, and in order to be able to get the kind of emotional supports that they themselves need. Childcare is really part of the overall village in which our children are being raised these days. And in the absence of childcare that occurred during the pandemic, many families were very hard pressed to manage their children's education, their children's emotional and social well-being, and maintain jobs, whether they were remote working or whether they were working outside of the home. The loss of childcare was a major hardship for many people. But I just want to acknowledge that it's not just how families with young children have experienced the pandemic in terms of childcare, but it's also how providers, childcare providers themselves, have experienced the pandemic and what they've been going through. There's been a lot of reporting about how the early childhood development provider workforce was not really treated the same way as the education workforce or other essential workers in terms of priority for access to vaccines, in terms of whether when it was mandated that things shut down, that it was considered safe for them to stay in operation, and a variety of other things. And so providers have been especially hard hit during the pandemic. We see this play out in our data. And again, this is limited data because this survey is just getting up and running. It's not as long-standing as the household survey. But when we look at the rates of material hardship among providers, the ability to pay for basic needs, 1 in 2 is saying to us that they can't pay for a basic need such as food or housing or utilities. So these numbers are higher than what we're seeing in the households with young children. In part, I think, because many early childhood providers are in the lower income range, but should be a major concern for us that those who take care of our children themselves are having a very difficult time making ends meet. And it's important to recognize these numbers are still relatively small, but it's in particular among Black and Latinx providers, early childhood providers, that we're seeing these kinds of issues be so predominant and so prevalent around difficulty paying for basic needs. So again, structural inequalities based on race and ethnicity play out not just in terms of households, but in terms of what we're seeing with providers. I mentioned the open-ended questions that we've been asking households over the course of the survey and how we've analyzed some of those data. I showed the differences based on race and ethnicity in terms of the concerns. This is just a simple word cloud that shows kind of the most common words that are used by providers when we ask them, what are the biggest challenges and concerns that they're facing right now? And you can see in here many concepts that are related to safety, to concern about getting sick and about the virus itself, also about what happens in terms of their well-being and their income if they do get sick, and then also notably concerns about parents and how they're doing. So I think that really stands out, that for providers, that safety and how they're going to actually be able to make it through financially as a result of the pandemic are major themes. This probably needs no explanation, but when we ask providers what they would like policymakers and elected officials to know about how their family is doing right now, it kind of comes through loud and clear. They need financial help. They need help paying for the added expenses and the income loss that they've experienced during the pandemic. So financial relief, not just for households with young children, but for those who take care of our young children, seems to be extremely important, as well as ongoing concerns about issues having to do with vaccine access and safety overall of the jobs that they're doing. So I'm going to begin to draw things to a close here in terms of my remarks, and then we'll have plenty of time for additional discussion and question and answer. But what I really want to do is start, and I'm sorry about the first 5 Alameda's note here on the top of this slide. This is really a set of general policy recommendations, but apparently I forgot to remove that from a prior webinar. The overall recommendations are really that as we move forward and as we think about the federal policy that is being put in place, that's going to ultimately impact and come down and be implemented in terms of things at the state levels and at community levels, at the levels of cities. We're really emphasizing what we're calling 4 cornerstones of what all families, all children, and those in the lives of children really need to be successful. So first and foremost, there is no question at all that one of the things that we're seeing is this extent to which material hardship and difficulty paying for basic needs to be addressed. And we're very excited, as I know many others are, about the child tax credit, about other ideas that are coming about how households may be able to have more guaranteed and regular and predictable income when they have young children. We think that those things have been needed from before the pandemic and will continue to be needed. But I want to emphasize a couple of things in the kind of focus on financial stability and on relief from material hardship. First and foremost, our data show that so many families have accrued more debt during the pandemic than they had beforehand, that we're very concerned that as money starts to come in, people are going to expect that it's going to have an immediate impact and that people will suddenly be in an okay position. And I think it's safe to say from our data that among households with young children, that there's going to be a period of time where people are paying off back rent, paying overdue utility bills that haven't been paid for a year or more, and still paying off other debts that they've accrued, credit card debts, just for other kinds of things, like to make sure that their car is running and that they have gas in their tanks. All of those things are going to take a long time and really, therefore, require not just one or two time stimulus payments, but more continued efforts to promote financial stability. There's been a lot of talk about 50% of the population being raised out of poverty by the new Biden policy efforts if they come to fruition. But I think one of the things that's safe to say based on our data is that even if those households are raised out of poverty, if the relief and the efforts don't continue, they'll fall back into poverty, as we've seen with many of our households that were more prosperous before the pandemic. If you put a support in place and then take it away, it's not going to lead to lasting changes. So that's certainly one thing that we want to emphasize, is that financial relief and stability are going to make a huge difference, but they shouldn't be expected to make a difference immediately, and they're really going to need to remain in place if they're going to really have the desired impact. The other thing that we really want to see acknowledged is that even if families are doing better financially, that will help a large portion of families and be what they need. But there are going to be many additional needs in the households with young children that continue to need to be addressed in a more substantive way. And so one of those ways is through systems change that has to do with child and family services in order to promote all of these different areas that intersect in the lives of young children. It's not just mental health and behavioral health in infants and young children and in their parents and access to those services, but it's how those things intersect with physical health and the medical system and healthcare system, with housing, with the education system, to the extent that families have complex needs and need to really navigate this complex array of services. The integration of services is going to be critical as we begin to come out of the pandemic. And as we look at particular families where the risks are greatest, whether they're ones that have been exposed historically to structural inequalities or those who have special needs children, those kinds of systems changes are going to be essential for us to be able to really provide the supports over and above relief from financial stress and material hardship that are going to make a difference. The third cornerstone really has to do with emotional support. And here we're talking about the kinds of emotional support that in our survey we found provided the greatest buffer against the basic material hardships and difficulty paying for basic financial needs that have been so common among households with young children. This comes in formal kinds of supports like home visitation programs, clearly in making sure that people have access to quality childcare and that the childcare workforce is in a good place to provide for the needs of families by virtue of the fact that they're earning a livable living wage, that they have access to healthcare and things themselves. So formal supports to help with the basic kind of emotional web that all parents and children need. And informal as well. What can communities do to come together in order to provide the support that all families and all children will need? And in particular, as I mentioned, those who have struggled the most during the pandemic. And then we don't want to leave this last cornerstone out. I think it's too easily and too frequently overlooked. For people who have more financial stability and greater access to money, we often talk about things like work-life balance and making sure that you get time off. For those who are facing basic needs challenges, who have material hardships in their lives and worry about not being able to get enough food or whether they're going to be evicted, it's always a focus on making sure that there's enough income. And we typically, I think, have been very hesitant to say, well, everybody in our society needs time in order to have that kind of work-life balance, but also time when you're sick to stay home and not worry about losing income, time when your child is sick to be able to stay home and not leave them alone while you go off to work because you're worried about losing your job. And for that matter, the kind of leave policies when young children are born that we know help to promote relational health and child development and child brain development in those early months and years of life. So time can't be overlooked as something that we should be focusing on in terms of policy reforms and in terms of acknowledging that all families need in order to raise healthy and thriving children. The last thing that I want to mention in my presentation is that the tools that we've discovered in this period of time during the pandemic with Rapid, tools that involve collecting a large quantity of representative data that allow us to really tell the whole story of what households are going through, what providers are going through, using quantitative data and qualitative data. These tools are not things that I think will sort of cease to be useful after we begin to emerge from the pandemic and the masks come off and things seem like they're returning to normal. What we've realized is that this tool can give us immediate access to hear from those with young children and those in the lives of young children. What's going on with them? What's going well? What do they need? And I think, especially for somebody who's a researcher, myself, and also a program developer, and somebody who in the past was a practitioner, I really think that this is an optimal time to be flipping the script and not thinking about what is it that we think that families need, what is it that we think that providers need, but to really start to listen to them. If you listen, and we've been doing this now for the last year, every other week and initially every week. If you ask people, what's going on? How are you doing? What do you need? What would be good for you? What's not there? What would you like people who are making policy decisions, who have access to resources, to know about what's important to you right now? The kinds of programs and the kinds of supports that need to be put in place can be developed in ways that have a much better likelihood of fitting the needs of families. I think in the original design for National Head Start, been hearing a lot from people who were sort of there at the outset, or whose early mentors were people who developed the original Head Start program. A lot of these ideas that we're talking about now are nothing new. There was always a plan for Head Start to be kind of a national laboratory for understanding early childhood development, for empowering and listening to parent voice and making sure that parents were determining what kinds of services were being put in place and supports were being put in place. And so now as we move to universal pre-K and we move to a large amount of money coming in for birth to 3 care, I think we're facing a similar set of opportunities and we really need to take advantage of them. And our sense is that Rapid and the tools that come with Rapid can be a really instrumental benefit in that capacity. So if there's anybody that's listening in on this webinar that thinks it might be useful to think about implementing what's historically up to this time now for the last year been a national survey, but thinks it might be useful at the level of your community to understand the strengths and needs that could inform policy and programs, and to document whether things, once they're put in place, are making a difference for families. I encourage you to reach out to me. We're having a lot of conversations now with communities as all of these policies come into place about how we can potentially implement the rapid survey at community levels, at county levels, at city levels, and really see this tool come into its own as a way of understanding what's needed to inform and design policies and programs for households with young children and for those in the lives of young children. So as I said, we can make sure that you get my contact information and put it in the chat, but I really want to encourage you to think about that and to connect to others in your community to the extent that you think that this is a possibility, so that we can see this really realize its full potential. So I'm going to stop there. I'm happy to take questions about any or everything that I've talked about. I'm also very interested in hearing comments from participants about things that they've been experiencing, challenges that they've seen, things that they would like their policymakers to know, and for that matter, to hear about other things that maybe you'd like to know that we didn't present in the survey. Maybe we have data, or maybe because the survey is ongoing, these are things that we can put into future surveys. Things like the question about debt and how debt has increased was something that was suggested by a webinar participant when we were talking about just the material hardship. And so a lot of the best ideas have come from people who've heard about the survey and say, hey, what do you know about this? And that's something that we then add to the survey. So thanks very much for listening. And I look forward to the discussion that's about to follow. And I'll stop my sharing so that we can all see more faces and less slides.
Dr. Fisher, thank you so much for the work that you're doing and for this very informative and yet sobering presentation. This has been wonderful. Several people asked about getting the PowerPoints, which will be posted on the TTAC website along with a recording of this webinar. So thank you. I also wanted to remind people, please, to fill out the evaluation, which will be posted in the chat box. So it's now my pleasure to turn it over to Dr. Susan Chinitz, who's the clinical co-director of the Training Technical Assistance Center, who will field the questions. And there's quite a lot in the chat box here, so we look forward to a very rich discussion.
Okay. So Dr. Fisher, there are questions about whether there's been any data specific to Asian households.
There has been, and I would be happy to share that more offline, so people are welcome to get in touch with me. Generally speaking, Asian households have looked more similar to white households and less like Black and Latinx households. But I think one of the things, and this is true for across all subgroups, there is, as with Latinx households, a huge amount of diversity, cultural diversity and economic diversity among both Latinx and Asian households. And we have been hard pressed to get enough households into the survey in all groups other than white in order to really do the kind of appropriate segmentation to be able to draw conclusions. So we sort of do these very general like analyses that look at how Black and Latinx and white households differ. But in our dream, in addition to collecting data from specific communities, we will be oversampling in specific groups like Asian American families in order to understand how there might be variation across Asian American families in addition to within in how everybody's been doing. So great question, and thank you for that. And again, I can get more data individually to people about those kinds of things.
Okay, there was a question early on related to whether the survey can be translated into Arabic, or has it?
Yeah, another great question. So these are all things that are aspirational for us. We would love to do them. We'd love to have more oversampling in households of color that I mentioned. We also, when we started the survey, in terms of the kind of budget that we had and continue to have, we knew that we would be limited by only having it available in English and Spanish. We would love to be able to be launching it in Arabic, in Mandarin and other Asian languages, Chinese languages, and across the board, so that it's more accessible to people in native languages. So that's something that we hope will happen over time. Has not happened yet, but we would invite the possibility of that for the future.
Okay. There's one comment that leads to a question. Dr. Fisher, thank you for sharing this critical information. Wondering if you have data resources for children in foster care specifically.
Again, these are all, it's sort of the same set of questions. We historically have done a very large amount of work in foster care and understanding the needs of foster parents and children in foster care, as well as the birth families of children who are in the foster care and child welfare system. We have not oversampled for children that are child welfare system involved. We think that's extremely important. There's been a lot of really important messaging around how actual overall reports of maltreatment went down dramatically during the pandemic, simply because the typical ways of identifying maltreatment through both healthcare and through the educational system were really compromised. And so these are areas that are going to be really important. I do not have specific data on how kids in foster care and foster families have been doing during the pandemic, but we're very interested, again, in oversampling among foster care and child welfare involved families as we move forward.
Okay, this is a long one. I'll try to get it right. I'm working on a project in the Bronx, New York. We are looking to expand universal screening for family wellness throughout our community partners. The focus of screening has been an evidence-based tools or recommendations for parent caregiver depression and child development milestones for 0 to 5. Based on your work, it seems as though we should prioritize screening for material needs or stability before mental health or domestic violence needs. We'd love to do it all, but we'd like to start implementing on a high impact piece, build successful referral networks, and then expand our screening into additional areas. So I think the question was how hard to prioritize screening for financial well-being or hardship.
It's a great question. I think screening is extremely important. And, the fact that, for instance, in well-child visits, that postpartum depression is now something that routinely gets screened is a really important extension. It's not just is baby, the right weight and growing at the right rate, but also how's mom doing in terms of her well-being, which could impact nurturing of the child and her own long-term well-being. I think what we've learned about material hardship is that we should be asking about that if you want to know why somebody's so stressed out and you miss the context that they're worried that they don't have enough money for food for the next month. And in our open-ended questions, we've seen so many comments that have just been devastating to read. That is, parents saying, I don't have enough money for food. I know that there's free food available in a food pantry in my community, but here's the deal. I have to choose going to work or going to get the food. If I go to work, my kids are left home alone and I can't stop off and get the food on the way home. So I have no way of getting the food that's available. And great example of where a community might think anybody that needs financial relief or material hardship relief can get it. And yet parents are telling us, no, they can't, that it can't, if the food doesn't come to them, that they're then faced with these horrible dilemmas of leaving their child alone, of risking losing income or losing their job altogether in order to get food. And so, yes, I think if we're worried about and we're concerned and interested in understanding parent well-being, then asking about material hardship is essential. And it doesn't have to be. Our material hardship questions have focused at times on just a very simple: are you worried that in the next month you won't be able to pay for any of the following? Check all that apply. That's like a 1 minute set of questions. It doesn't necessarily have to track from things. We've also frequently been asking a little bit more detail about food insecurity and hunger. But again, that's like 10 questions about people's ability to pay for food. So yes, I strongly encourage people to really be thinking about the extent to which they can screen for material hardship as this root cause of what might be going on with families. Otherwise, you might miss the context of why people are struggling.
This is all wonderful information, Dr. Fisher. Thank you. It is also overwhelming, and I am always questioning what I can do as a home visitor. Any suggestions on what we can do at the ground level?
Yes, and I totally want to acknowledge the incredible efforts that people have put in during the pandemic, above and beyond, in terms of trying to think of ways to continue to support families when historically it was by being in person, dealing with issues around access to technology that made it difficult to be in touch with either yourself to have adequate technology or families to have adequate technology to be in touch remotely. So many things that have really been challenging. And I want to get to the sort of the one thing that has consistently stood out in our data as what helps to break the links in the chain reaction of hardship, and that is emotional support. The emotional support that people have been reporting consistently mitigates and offsets the material hardships effect on well-being across the board and across time. And among the things that we've seen is that people report that their sources of emotional support have become much more local during the pandemic. So people used to say, I got support from coworkers and I got support from my friends. And now people are saying it's my neighbors and it's my own children, especially young children. And I think even as a home visitor, one of the things to remember is that if you can just call somebody up on the phone and say, how you doing? Like, what's going on? And bear witness and help to just let them know that there's somebody there listening, that can go an incredibly long way. It can make a huge difference for people who are at home, who are isolated, who are trying somehow to balance work and childcare and their kids' online learning and everything. So that, I think the overwhelmingness is totally understandable. I really want to validate the challenges that everybody who's in the lives of young children and families has been going through, and remembering that just by being there and being present and being a support, that can go an incredibly long way to helping to reduce these toxic stress effects. Can, I think, sometimes at least give some sense of you're actually making a bigger difference than you might know.
That's a very reassuring response. Thank you. Here's a related one. I'd be curious to hear Dr. thoughts on recommendations for programs and policies within nonprofit organizations serving young children and their families.
So my recommendations are, first and foremost, that at the center of what we really know from lots of decades of science makes the biggest difference for children is nurturing and responsive interactions with meaningful adults in their lives, adults with whom children have consistent relationships. That can mean mom, bio mom, or bio dad. It can mean foster mom or foster dad. It can mean auntie, grandma. It can mean childcare provider. The idea is that, as I mentioned, that these kind of serve and return processes that go back and forth between adults and children are really the primary ways in which we see healthy development unfolding across time. So any way that program can support children having nurturing and consistent adults in children's lives who can provide that kind of nurturing and comfort is going to be absolutely sort of one thing that you can do. Number two, I would strongly encourage programs to think about what are the sources of toxic stress in people's lives. And that's where the material hardship stuff comes in. So how can you help people who you serve get access to what they need to help them prevent being evicted, or at least to help support them if they're dealing with eviction situations. So reducing those sources of toxic stress, especially stress from worrying about paying for basic needs. You may not be a housing expert, you might be a pediatrician, but if you're asking about whether people are worried that they're going to lose their housing and helping them deal with a possible eviction, you're going to be going much further to helping the child's well-being than if you're just asking about how the child seems to be doing in terms of growth and development. So that's number two. Number three, I think programs that build kind of core skills, core basic life skills in parents, in children, that support these in providers as well. And in particular, there's lots of talk of executive functioning skills, these kind of basic skills that people need in order to manage. There are things like being able to regulate your emotions, being able to stop when you're having a hard time and think about what you should do, and even just being able to kind of keep a whole bunch of different complex ideas going at the same time and readjust when you encounter barriers. Things that help to build and support those kinds of life skills are critical in children's lives. And the research on this is pretty conclusive at this point, that probably the single biggest thing that can help with that in people's lives, adults and children, is predictability and consistency. That when things are chaotic and unpredictable, it's virtually impossible to kind of develop those skills, just because it's hard to detect patterns and to differentiate kind of cause from effect. So predictability, routines, things that make it so that there's greater regularity are the things that really help to support the development of life skills, and therefore what programs can do in these areas to help increase the extent to which things are predictable. And when it comes to things like income, that means that if people are at a certain income, that helping to make sure that they're not worried that from one month to another, the money that they have is going to fluctuate wildly. That's clearly something that came out of our data. Great questions.
What was the geographic scope of those surveyed, both households and early childhood providers, and what was the N collected from each of the two survey groups?
The scope is all 50 states. So we've been getting data from everywhere around the country. We recruit through a variety of online partners and through some social media advertising. And so the numbers are quite large from everywhere. They typically, if you think about the sort of the size of a state's population, we get more participants from states that are more populous. So Texas, California, New York is where we have more. But as I said, we have data from all 50 states in the household survey. The way the survey was designed originally and continues is that some of the people who take it repeatedly in an ongoing manner, and some people who only take it once or twice. And so in that way, we have kind of this combination of longitudinal data and one-time data, but we can put all of the pieces together, kind of like planks across a span of time, some of which are shorter and some of which are longer, in terms of participants who've taken it maybe once or a lot of times. All of those planks overlap, and that's how we're able to tell the long-term kind of story of how things are unfolding across time. We've had over 9,000 people, 9,000 parents and families take the household survey through to date. And that provider survey is just getting up and running. As I mentioned, it's only been going for 4 weeks. And at this point, we have around 500 participants that have taken the provider survey, but we expect those numbers will grow. And our hope is that every time we launch the provider survey, in short order here, we'll be getting 1,000 providers as well.
There's a question about accessing specifically New York State data.
Would love to make data from specific states available. I want to put in a huge disclaimer, and it's really important from a research perspective, that even though, for instance, in New York State, we have a large number of participants that have taken the survey across time, we did not sample in any particular state to be representative. So our survey is representative nationally of geographic distribution and of things like income. But really, whoever has taken the survey in New York is not necessarily in the same way representative. And so we're really wanting to be cautious about data that we're providing from more kind of granular analyses, because it may or may not reflect the population of the state. But with all of these questions, my team can get back to people with responses to specific questions that we may not have had time for in this survey. And I put my my email address into the chat, but I'll just put it in one more time so that if people want to reach out to me, I can make sure that I'm responding to sort of more individual requests.
There's a question about, will you be able to continue this for a more longitudinal look at the impact of the pandemic?
Oh, I love that question. We would love to be able to continue the survey. We think that the pandemic was sort of the time when the survey began that was really important, but we've really seen it as now an ongoing tool. And so we hope that we'll be able to continue the survey. But also, one of the things that we're now in the process of doing is generating applications for federal funding to follow longitudinally across time the families that have signed up for our survey. If you think, okay, we're almost at 10,000 families, if we stayed in contact with those families, those who want to keep in touch with us, we can ask how they're doing as the weeks and months and years go by to see how people have emerged from the pandemic and how they're doing across time. So there's both the survey being continued across time to be an ongoing snapshot of how people are doing, but there's also just the families and the providers and following them to see how they and their children kind of do as time passes from the pandemic.
Have you explored how families access information, referrals, and resources to strive towards self-determination, specifically telehealth for patient portals, broadband devices, communication preferences, service provision choices?
Yes. Yes, we have. And we have a lot of data on that I didn't present here. But yeah, I mean, there's them, and the stories across almost all of the measures that we've collected are fairly similar in terms of what you might expect. So at lower income levels and among households of color and among single parent households and among households with a special needs child, the issues around access to services, the barriers in accessing services, the issues around technology access, even the types of, for when we ask people about both childcare, early childhood ed, and for when they have older kids about schools, when you get into groups that have traditionally faced inequalities based on race and ethnicity or other things like family structure, what you see is less access. You see, for instance, with school, less hybrid and in-person school, much more online only school. So I just want to acknowledge that different pandemics have been dramatically experienced. And I certainly know many people who are middle class who have struggled mightily in terms of work and work-life balance during the pandemic. I don't want to trivialize the challenges that everybody has faced. I especially want to acknowledge that women have done an inordinate job. Sort of, they're the unsung heroes, moms who have continued to take care of kids, continued to work, and have borne a disproportionate share of the burden of work and childcare during the pandemic. So everybody has had challenges to face. But I also want to acknowledge that among some households, the challenges have been much more like life or death challenges and much less just like a very difficult time that we will emerge from.
I'm wondering if you've learned about some strategies worth replicating involving communities themselves that have been able to support one another. It seems like so many folks that are struggling are also finding ways to support others.
You know, there's a lesson from, and it's a difficult sort of parallel, but there's a lesson from the Rwandan genocide chapter where when researchers studied communities following that horrific period of time, what they found was that communities in which people came together following those tragedies and those difficulties to really develop ways to recover as a community, that individual well-being improved far more than in where communities didn't come together. And I just think that this is sort of a important and not surprising piece of information, that it really is about the connections that people have to each other that make the biggest difference in terms of how people can come together, and especially in circumstances where one of the themes across all groups and all income levels has been about feeling isolated, that ways to help bring people back together as schools reopen, as childcares reopen, as parks reopen, that communities that can do things to help bring people together will make a big difference. But I also want to get back to the data that I've been presenting. So what can communities do? Communities can think about how to address material hardship, how families that are worried about basic needs can have some relief from those worries. As a sort of first and foremost thing, communities can think about what are the formal and informal supports that might be available to people, and how to make sure that parents have time when they need it. I know, for instance, in Minneapolis, there is a great organization called the Minneapolis Crisis Relief Nursery that provides a drop-off place for families that are just in a situation where they need to focus on something immediate that's a crisis. Maybe it's about eviction, or maybe it's a relationship difficulty, but they know that they can place their child someplace safe briefly while those kind of crises get dealt with. Those kinds of organizations are really the glue that helps to hold things together. And they're really the things that, especially as cracks have widened and become deeper, can help push things back together so that people can stick together. So I think there's an inordinate amount of stuff that people can do. And I think this is really an opportune time, especially with what we've gone through in the last 4 years, to be thinking about how to be connected to each other as opposed to kind of at odds with each other as things move forward.
Okay, with the pandemic, all of us have spent increased time indoors. Millions of children in the US live in homes with environmental hazards such as lead paint.
Mm-hmm.
Do you have any data related to health issues such as increased rates or severity in lead poisoning, asthma, or problems like that?
Don't have that. I think it's a really important question. I think part of the issue there that this participant raises relates to the interruption in healthcare that's occurred during this time. And so the data probably are insufficient at present for us to know if there are increases in exposure to lead or other toxins, increases in asthma due to environmental pollutants. But I think what's most important is that we get back to where we were in terms of preventive healthcare as things reopen, and as it becomes safer for people to go to the doctor, so that issues that may have arisen during this time can be detected and where support can be provided as much as possible. So I think it's less about what we know right now and more about what we're going to be learning, and then making sure that we have the right kinds of surveillance and detection and screening methods in place for that.
There's a question about what schools can do to support children and families.
Schools can do so much to support children and families. And again, I think one of our big learnings from the survey that may be old news to many people listening in, but there's been this divide where we have thought about early childhood and care in early childhood as babysitting. And then we think about the educational system, primary school and beyond, as where kids do their learning. But I think if the pandemic, with the absence of school and the absence of childcare, has taught us anything, it's that early childhood settings are not just babysitting, they're also places where the basic foundations of learning help to be put in place, in addition to what parents, as their kids' first teachers, can do. And similarly, schools are not just a place where kids go to learn. They're a place where kids are safe and where parents can rest assured that kids are in care. And so as schools were not functioning, a lot of people were having their older kids go to childcare because they needed some place for their kids to be when they were working. And I think the idea that schools are essential in the lives of parents as another form of support, as a place where quality care is happening and kids are safe, is as important as the fact that we need to recognize that early childhood settings are educational settings. And in that sense, I think schools can provide the kinds of community networking that are and have been essential during the pandemic and will continue to be. And we saw this in so many communities where schools, after free and reduced lunches went away because schools weren't in session, schools set up food banks where parents could come and get food even while schools were closed. So I think a lot of schools know the value they can be in being, again, another form of kind of glue that helps to hold communities together. Just remembering and embracing what teachers know, which is you're not just, providing learning, but you're also providing care and a neighborhood and a village for children is, I think, probably the most important thing.
So well said. And I think we have time for maybe one more question. I wanted to remind people to please fill out the evaluation and maybe take one more question.
Okay, hard to pick one more, but there is a question about your recommendation for integrated care. And the question is, do you have any specific examples?
There are many examples of integrated services. I think the issue is, what are the hubs from which integrated services can happen? So a great example, I'm not touting any one program over another, but just as a case in point, Healthy Steps is a program that is a national program. It provides a navigator, a Healthy Steps specialist in the pediatrician's office to help address any issues that a family might be dealing with during a routine pediatric visit, not just a preventive healthcare visit. And that means that if the family comes in, whether it's for a checkup or whether it's because the child has a cold or some other illness or injury, that there's somebody there. If there's a housing issue, to help connect them to housing. If there's an employment issue, to help them with employment or income. And so really it's like there's somebody there to help them get beyond what the pediatrician or healthcare practitioner might provide. And the same kinds of networking can be done in schools, can be done in public housing. So it's not so much that there's a model program or a single platform in which this is happening. It's that any context where families and children are connected can provide this kind of integrated kind of support. And I think that's what we're going to be seeing in kind of the future of family supports, is this kind of like, it's not siloed. It's really that you can have a one-stop shop that's going to get you connected to what you need in order to be successful and in order to have your child thrive.
So I know we're out of time. I'm just going to say there are a million comments in the chat telling you how much people appreciated this talk and the importance of the data you presented. And there are some inquiries about how people could partner with you, get the survey out to populations.
Great. Very exciting.
We will send you the questions to follow up. But thank you so much for the work you're doing, for this incredible presentation, and also your generosity in responding to questions. So thank you, Susan, for fielding them. And this has been excellent. And again, we will post the webinar and the PowerPoints on our website. And thank you all for joining us today. And thank you, Dr. Fisher. This was amazing.
My pleasure. And thank you all for your great questions and comments. And thanks for inviting me.
Thank you. Thanks, Susan.
Yeah, there was a lot here. It was hard to, there's, a lot of